People who have bunions and hammer toes aren't just dealing with the way their feet look. It also causes progressive pain, making it difficult to walk or even wear most shoes. For decades, the treatment involved placing metal hardware in the foot, which usually meant more discomfort and additional procedures were needed. Today, an amazing new technology can replace metal implants. Instead, OSSIOfiber restores, regrows, and renews the bone using organic minerals for a more natural way to heal. Foot and ankle surgeon Dr. Robert Moore shared this innovative new procedure, and his patient Tara Scantlin now has happy feet because of it. Dr. Moore, when we look at our foot and our ankle, it looks like this one big unit, but when you get underneath there, there's lots of moving parts, lots of little pieces. You were that kid, weren't you?
Yeah, it seems like back in the 60s without iPads, there was nothing to do but run around the fields with your friends, make little models, and tinker on car engines. That's all there was.
Yeah. Now you tinker to make people feel better and make their feet look better. You do simple or complex problems. You work on, every age range, but ankle, heel, arch ball, or foot pain, arthritis, fractures, sprains, problems related to other conditions like diabetes, and corrective cosmetic foot surgery is one of the other things that you do.
That's the most rewarding. I think that now with all the technology that's come out, one of the products we'll talk about today, but some of the procedures like the quintessential hallux valgus or bunion corrections, the toes we're straightening, shortening, and even corn removals. Also the bunionettes, they're all easily performed on an outpatient basis now.
Yeah, okay, so the orthopedic surgery standard used to involve metal implants and hardware, had been used for over 100 years. And as we know, just like almost everything, technology has advanced. It's a much different process today, so I'm gonna hold you right there. And Tara, what did you see your mother go through?
She had her bunion surgery done, and it was hard on her. The recovery was hard. She had it later in life. And that was something I really kind of wanted to avoid.
Yeah, and again, that's what a lot of times people do, is they put stuff off because they saw their parents going through things, not realizing that there's a new system. What were you dealing with that you were needing to get some help?
I'm kind of an active person. I mean, not triathlons or anything, but I started experiencing some hip pain and some issues with my knee, and it was time to finally address it. And
yeah.
It was just from me favoring my foot.
All right, and Dr. Moore, what was happening with her?
The basic hallux valgus deformity where the large toe joint is being pushed over. Also, a little bit of jamming that happens that people are unaware of without arch support can make the joint drift and the bone push out.
All right, so you were able to address this with a new technology. Tell us what that technology is.
It's called the OSSIOfiber bone pin. And what happens is, like you said, back in the day, we would fixate with a staple or a screw or a metal pin. What this is avoided is that not only does it incorporate into the body after the patient is healed, but accelerates healing time, and of course you don't need to remove it.
So many more advantages. I would think if you accelerate healing time, that means that you avoid other injuries and things like that as well. What about securing the bone? Because there are some things that we kind of put in there, I guess, to almost replace the bone, but then other things integrate with your bone.
Yes, and again, that's one of their properties. They've taken the cortical bone that's on the outside and they've made it with an absorbable material to make the pin stronger so it won't break. It has ridges, and as you move the sections across, which is called an osteotomy, you can place the pin in there and tap it in with the equipment, and it fixates it just like you would a normal fixation device.
Yeah, and Tara, how's that been for you?
It's been great. It really has. I mean, I love the fact that I don't have to upgrade any hardware later in life.
Yeah.
That it'll just be kind of one, and I love that.
Yeah, that's a great point, not having to go back again. Like what types of injuries? Is it just that one, or are there other things that this can be used for?
Yeah, they're actually, the toes themselves, you can keep them straighter. You don't have the metallic pins in those. There are some other uses. There's an actual screw that they make. You can have a malleolar fracture in the ankle and actually put that type of fixation in there, and it will fixate the bone, of course, and not have a metal screw that may need to be removed later.
Yeah, a lot of us have had some kind of foot pain. At what point do we bring ourselves into a Dr. Moore?
If it's altering your lifestyle, you feel that ache when you first step out of bed in the morning. I tell my patients usually morning pain is injury pain, and end of the day achy pain is when you've done too much and you're having an overuse syndrome.
Yeah. All right, Tara, we know how people are. They're like, I'll put it off for another day, put it off for another day. What do you say to folks who are dealing with foot pain and they keep favoring, like you said, trying to get through somehow, thinking that they can put a gel in and it'll take care of things, right? What do you have to say to them?
The sooner the better. I mean, at the end of the day, like your body's a temple and you get one shot.
Yeah.
So the sooner the better.
All right, please tell me high heels have nothing to do with it.
Nothing.
Okay, good. La la la. I was going to say la 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 la. All right, thank you so much. Anyone interested in learning more about OSSIOfiber can go online to naturalfootrepair.com. You can find background information about the procedure and locate doctors. You can also visit Dr. Robert Moore's website at mfaspecialist.com. That's mfaspecialist.com, or give Dr. Moore a call at this number, 281-444-6300.